I believe strongly in constitutional prescriptions. So most 99% of my prescriptions are going to be basically constitutional prescriptions. But there are always patients who need to be looked at differently. And you haven't come to the homeopathic world, you lay your hand on the book and say, I swear to only prescribe the constitution, nothing but the constitution, so help me God. You can't do that because we believe in individualization. And every individual is different, and the approach to every patient could be different. So I'm going to talk today. This session actually is more than 3 hours long, but I'm going to condense it for you guys. I'm going to talk about how to be more rational and more scientific in your approach to homeopathic prescriptions. Nowadays, I have been revisiting some of the old authors, and my current book is The Lesser Writings by Dr. Samuel Hahnemann. And I would like to share with you what I read in one of the chapters. In order accurately to perceive what is to be observed in patients, we should direct all our thoughts upon the matter we have in hand, come out as it were, and attach ourselves, so to speak, with all our powers of concentration upon it, in order that nothing that is actually present that has to do with the subject and that can be ascertained by the senses may escape us. So you are supposed to be looking at the patient and try to find out as much as possible by taking a good history, by your observations. And when you talk about observation, it also means you need to examine patients, which I feel is very important. Having been a clinician and I've worked with one of the top conventional medicine hospitals for a number of years. I was trained in clinical medicine and internal medicine. So for me, the approach to every patient would mean give a constitutional remedy, but you also consider not just the mind and the physical generals, but also try to find out what is the pathology. See if the homeopathic remedy that you want to give also covers that particular pathology. Look at the miasm and then form a blend. See that you give a remedy that covers everything. In that case, you are definitely going to get the response. Unfortunately, nowadays, for many years actually, there have been different thoughts in the homeopathic world. There are different theories. Each one comes up with a new theory. We have, in the US, we have 4 or 5 homeopaths who have a cult following. We have a few in Canada, and we have multiple homeopaths in India. And people swear by them, and those people have their own theories about how to prescribe. Hahnemann possibly knew about this because he writes, poetic fancy, fantastic wit, and speculation must for a while be suspended, and all overstrained reasoning, forced interpretation, and tendency to explain away things must be suppressed. The duty of the observer is then only to take notice of the phenomena and their course. His attention should be on the watch, not only that nothing actually present should escape his observation, but that all what he observes be understood exactly as it is. And that's from this wonderful book that I've been revisiting the last few days. So this is from the chapter Medical Observer, which you'll find in the lesser writings. Now, for you to be a good prescriber and to be rational in your prescriptions, I feel you should have some knowledge of the basic sciences. That means you should be able to understand what is normal first in order to know what is abnormal in your patient. And that's why in most schools, whether you have done a part-time course in homeopathy, whether you're a full-time medical college where you're taught homeopathy, you always go through physiology first, and of course anatomy. And then after you master physiology, you then progress to pathology, which is the abnormal structure and function. And once you know pathology, then you study medicine, surgery, and gynecology. Now, why is this important? Because not every case may necessarily need or get a constitutional drug. And there are some cases where you might have to prescribe in pathology. But to understand that, you should know what is normal and what is abnormal. So let me give you an example of a patient who comes with an acute pain in the knee joint. This pain is worse at rest, worse from the initial movement, and the patient's pain is better by continued movement. I'm sure you all must be thinking of the remedy by now. 99% of you must have thought of Rustox as a drug. But there are two other remedies too. And one of them is Ruta, and the other is Calcarea floor. So let's use this knee joint and try to understand acute prescriptions based on pathology, based on symptomatology, and how you can use your knowledge of the location and the pathology to make a good prescription. So we have three remedies: Rustox, Calcarea floor, and Ruta. All the three have the same modality: worse initial motion, better by continued motion. And I don't want to ever prescribe three medicines together to my patient. I would prefer to give only one single remedy. So how do I decide which is the remedy to be given? Now, if you look at the sphere of action or the location of Rustox, it is for the white fibrous tissue. So it's going to be basically extra-articular, where my pointer is right now, where the arrow is. So it's the tendon. The tendon, the white fibrous tissue, the aponeurosis, when those are inflamed and the patient complains of pain, which is worse first motion, better by continued motion, I would think of Rustox as a remedy. Now, if this person comes to you with pain in the joint with the same modalities, maybe he's in his 50s or late 50s and 60s, and when you feel the joint, so that means you're also supposed to examine now. You hear some crackling inside or cracking inside the joint. If he's come with an X-ray and the X-ray shows osteophytes, so you might find near the knee, in this out here, you might find some bony outgrowths where the pointer is right now, or here in the tibia. That means this patient has got osteoarthritis. And the drug that has a tendency to bony involvement would be Calcarea floor. And the remedy, Calcarea floor, would be useful in those people who have the same modality as Rustox, but the location is different. There are others who might come with a meniscal injury, or the cartilage within the joint has been damaged. So this is where your meniscus is. Unfortunately, the pointer is not a very clear. You can see here the lateral meniscus, and of course there's some cartilage also in the joint. So when you have meniscal injuries, cartilage damage, or cruciate ligaments, the X ligaments that cut across each other, when those are inflamed or when those are injured, then the remedy you could think of is Ruta. So see how the same modality, three different remedies, same part of the body, the knee joint, but your prescription changes if you know which part of the joint has been affected, whether it's the bony part, whether it's the soft tissue part, or the tendons at the aponeurosis, or whether it is the cartilage and the meniscus. By the way, in Kent's repertory, the remedy for injury to tendons is not Rustox, but it is anacardium. And it might be worth reading anacardium because anacardium and Rustox are complementary to each other. So people study anacardium only for the mental symptoms, or they study anacardium stomach symptoms, but they forget the skin and the locomotor symptoms because our focus shifts and it's only on one particular part of the body. So when you study a remedy, study it in totality. Don't just study one part of it. Now let's look at the other parts of the knee joint. There's a synovial membrane. You all know that it covers most of the joints. It helps in preventing friction. And in this knee joint, as you can see where my pointer is, this is the synovial membrane. Now, if the synovial membrane is inflamed and the person comes with pain in the knee joint, when it's a chronic synovitis, it could indicate maybe a condition like rheumatoid arthritis, but that usually affects the smaller joints. But if, for example, in this case, the knee joint, you have synovial or synovial involvement, two remedies will come to your mind. One is apis and the other is bryonia. So now you have two remedies. Both are right-sided remedies. Both are hot patients. Both have pain in the knee joint. Both have a swelling and inflammation. How do we differentiate the two? Usually you find in the case of bryonia, there will not be too much of effusion. There will not be fluid collection. In the case of apis, you'll find that there is always edema, swelling. So a red, shiny, swollen, edematous knee joint because of an inflammation of the synovial membrane is more likely to be apis. If it's just a painful, swollen knee joint, which is worse from the slightest motion, better by rest, then that patient most likely would need bryonia. Now, bryonia and apis, as I said, are both right-sided. Both are hot patients. Both will have stitching pains. Apis will also have stinging pains. There are mainly two remedies in our Materia Medica which are known for stinging pains. One is apis and the other is mercury. So these are the two remedies you could think of when a person has stinging pains in a particular part. The only way you can differentiate the two would be the thirst. Bryonia has thirst for large quantities of cold water at long intervals. Apis will be thirstless. The tongue of bryonia would be maybe thick, white coated, very dry. Apis, you might find a red, shiny tongue. It seems inflamed. So those are different ways in which you're now going to differentiate the remedies. So when I teach or when I study a patient, what goes on in the back of my mind is a lot of remedy relationship as I see the patient, a lot of pathology, and of course, the homeopathic Materia Medica, because that is basically going to be our armamentarium. That's what we are going to use. Now let's look at some other parts of the knee joint and study some of the other acute remedies. There could be an injury to the bone. If it's just a bit of the bone has been affected, what is called a green stick fracture, then the patient may need the remedy ruta. If the whole bone has cracked into two, then of course the remedy you might think of is symphytum. You can see one more feature here, and that is the subcutaneous infrapatellar bursa. A bursa is a small sac. So out here you see there's a small sac out here which helps in preventing friction. So it allows the tendons and the leg to glide over the bony part. Now, can you think of any remedy where this bursa can be inflamed? There is a remedy where you have a circumscribed red spot on the knee joint. Let's look at that in the Materia Medica. Let's pick up the Materia Medica. Let's read Sticta. Sticta pulmonalis. Let's read from Boric's Materia Medica. And sorry, Let me just move this aside for some time so I can scroll down. And you can see here, spot of inflammation and redness over the affected joint. It's a very good remedy for, as you can see here, housemaid's knee. So usually in the olden days, at least, the housemaid used to kneel on the floor and then she would either broom or sweep or mop the floor. And the knee joint used to always touch the floor and there would be some sort of inflammation. So that would lead to an increase or inflammation of the bursa and a bursitis. So when you have a sore red spot on the knee joint, what is usually found in housemaids or the housemaid's knee, you could think of this remedy, Sticta pulmonaris, for it. Sometimes you find there's a swelling behind the knee, what is sometimes known as the Baker's cyst. So here you have a diagnosis. The patient has come with a diagnosis of a Baker's cyst, and there's a pain in the popliteal fossa. The remedy for that could be, I'm not saying that is the specific, because I don't believe we should be looking at specifics. We are looking at possibilities. So in your mind, you should be thinking, which are the drugs that have that location? And the location for the back of the knee joint would be physostigma. Physostigma usually we think of for the eye, but it's a very important remedy also for the knee joint, and there's pain in the popliteal fossa. Now you might have some patients who come and tell you, doctor, my joints, they are so painful and they creak, it feels as if they lack oil. So sensation as if the joints lack oil. Of course, there's no oil there. You only have the synovial fluid there. But for laymen, they always believe there's some oiling mechanism that keeps the joint active. And let's go back to the Materia Medica. Let's look at the drug nephralium. Nephralium is generally thought of for sciatica with pain and numbness. But look at the last line here. Pain in the joints as if they lacked oil. So sometimes patients come to you with these peculiar symptoms, and if you have been reading your Materia Medica well enough, it's going to make it easy for you to consider certain remedies. So this is talking about the anatomy, how the anatomy, knowledge of anatomy, knowledge of location helps in prescription. In fact, as I was talking last week, I had a webinar on unconscious patients or coma, and I was telling the participants that one of my favorite authors is C.M. Boger. I'm a big fan of his, and Boger also has this emphasis on locations. Look at the locations, and then it makes it easier for you to study the Materia Medica and to prescribe the drug. So today I'm also going to show you how locations and pathology will be useful in understanding your homeopathic Materia Medica. We'll take the example of one remedy, but as we go further, we'll talk about how knowledge of physiology, how knowledge of pathology, and knowledge of locations help you in your understanding of the homeopathic Materia Medica and in your practice. So this was an example of anatomy. Let's go to physiology. Which remedy is known for, I'm sorry about this. Which remedy is known to have midnight aggravation? Patient comes to you with breathlessness, dyspnea, and they are worse at midnight. Most of us would first think of arsenicum album, because that's what we've been taught. Midday and midnight aggravation is the most important modality of arsenicum album. Now, I'm not sure how many of you have treated many cases of asthma, but you will find in your practice that you give arsenicum album to these patients who have midnight aggravation, and they don't seem to respond. You wonder what went wrong. You start wondering whether you made a mistake in understanding the remedy, or whether homeopathy doesn't work at all, or what. Now, we have always been told about prescribing on the peculiar symptoms and always discarding the common symptoms. Now, for the arsenicum album, midnight aggravation is a common symptom, because if you look at the circadian cycle of serum cortisol, that means in the human body, there is always a biological clock and there's a rhythm. Our blood pressure varies depending on the time of the day. Our red blood cells will change. Our temperature varies with the time of the day. Similarly, the serum cortisol, you know that the treatment in conventional medicine for asthma would be to give cortisol, either as a shot or as tablets, because it is going to suppress the immune system and it's going to also work as an anti-inflammatory. So when a person's cortisol levels are low, he is most likely to be affected by the allergens. And in the human body, around midnight is the time when the cortisol levels reach the lowest. So that's the time you're most likely to end up getting asthma. That's the time when you're most likely to end up getting all these allergic things. So you might find they start sneezing in the sleep, or they start getting breathless and it seems to get worse around midnight. So that's a common symptom. And all this time you've been trying to give arsenicum album for midnight aggravation based on this common modality. But 3 to 6 in the morning is the time of the day when the patients have the highest, or every person has the highest amount of the natural cortisol in the body. Cortisol is secreted from the adrenal glands. So that's the time of the day when you should not get bronchial asthma. But if you do, then you have these remedies which will be very peculiar and which will be very useful for you in your practice. All the drugs from the Cali group, Nux vomica, Thuja, they all have 3 AM aggravation. Amon Card, for example, another drug that has got 3 AM aggravation. Then you have Antimonium tartaricum, 3 AM aggravation. So these are the remedies which are very peculiar as far as the modalities are concerned, because that's the time when you have no business to get bronchial asthma, because that's when your body's cortisol is at its peak. It is protecting you. But in spite of that, if you do get it, that means the remedy is, these remedies, if you give, they are going to be much more useful and they are going to work very well. So if I had to give arsenicum album, I would possibly give it on the other features like the thirst, like the emotional state, the general state, but not on the midnight aggravation for bronchial asthma. If it was fever, yes, midnight fever, I would give arsenicum album. If it was maybe diarrhea, which comes on around midnight, that's peculiar to arsenicum album. But for the respiratory tract, for asthma, midnight aggravation is a common modality for this remedy, arsenicum album. Now, Kent, if you study the lectures on Materia Homeopathy by Kent, and you open up the remedy Thuja, you will find he writes there that a peculiar asthmatic condition is found in psychosis, and arsenic appears to be indicated for the symptoms, but it only relieves. So even he found that many of his cases of arsenic did not seem to respond to the remedy. And in those days, physiology was not so advanced. People are not aware of the circadian cycles and the cortisol levels. So the best he could think of was maybe it's a miasmatic influence. And he felt Thuja and natrum sulph will take up the work and cure. Now, both those remedies have early morning aggravation. Thuja is 3 AM, natrum sulph would be around 4 or 5 in the morning. So what do you find? Once again, the peculiar modality rules and the common modality doesn't. So arsenicum album given on midnight aggravation is not going to be very helpful to us in our practice. But all the other remedies like Amon carb, Antimonium tartaricum, all the drugs from the Cali group, Thuya, they all will be useful when you prescribe on this 3 or 4 a.m. aggravation. So this is very important. If you don't understand or you don't know the physiology, you will be able to, I'm sure you will all be able to treat your patients, but the response is more like a zigzag cure. You go from one remedy to the other, then you go to the third and the fourth, till you finally hit the right one and the case gets solved. But if you have understood your physiology, you would realize that you're making a mistake at the very start. Make sure you stop yourself from making that mistake and think of the right remedy for it. So pathology is going to help us because it defines the scope of homeopathy and the limitations. So if you know that a person has been born with some anatomical defect, you know homeopathy cannot work. So you know that this is outside the scope of homeopathy. Or there are genetic abnormalities. There are some homeopaths who claim they are able to reverse Mongolism, they are able to reverse Duchenne's muscular dystrophy. Unfortunately, I haven't seen that, so I would not like to really comment on what it is. But for me, I would most likely not take up such cases and give them a very rosy picture of a cure that can be accomplished with homeopathy. Purely surgical conditions, again, now I will use the word purely surgical because there are so many surgical conditions where a surgeon would love to open up. And I'm sure many of my colleagues, including Dr. Nimish Mehta, who's here, we have treated cases that was all set for surgery, and with homeopathy, we've been able to take care of gallbladder stones, we've been able to take care of kidney stones, ovarian cysts, fibroids, all these different conditions that are so-called surgical could respond well to homeopathy. So when there are purely surgical conditions where there's no scope at all, where there's a very large gallstone or a very large kidney stone, which cannot pass out through the tubes, then you need to consider going in for a surgical method of treatment. One classic case I remember when I was a resident in the hospital, the principal of our college, the dean, as you would call him, he had this patient admitted with a ruptured peptic ulcer. So the stomach lining there was an ulcer, and then that burst open and he developed peritonitis. There was only one symptom that this patient had, and that was he was feeling bloated, and he tried his best to burp from above or to pass out gas from below, and it was just impossible. So what did we do? We admitted this patient under him. We informed the surgeon that this person might need surgery, but we want to try homeopathy first. He was kept nil by mouth, nothing for oral. And we decided to give him IV fluids to maintain his fluid and electrolyte level and give the homeopathic remedy. Now, the head of our unit, Dr. Bhatia, who was handling this patient, he gave the remedy Refanus. Refanus has got incarcerated flatus, cannot pass it from above or from below. We had x-rays before treatment where there was air under the diaphragm, which means even under the right now of the diaphragm, that means air had leaked into the abdominal cavity from that perforated ulcer. Within, I think, 24 hours, we saw a dramatic change in the patient's symptoms. Pain disappeared, his bowel sound started coming back, so his peritonitis seemed to have improved. 3 days later, we repeated the X-ray. All the air under the diaphragm, under the right dome of the diaphragm, had been absorbed. The surgeon came and examined. He used to examine every day, and he said, this patient is now towards recovery. So homeopathy, in a so-called surgical condition, was able to treat this perforated peptic ulcer and prevent surgery from coming. If you know the pathology, you also know what is the limited scope of homeopathy. So malignancies, HIV and AIDS, patients who are on long-term steroid therapy you might find that they respond slowly to homeopathy. Acute myocardial infarctions, So very acute emergencies, sometimes the scope is limited. You need a lot of other infrastructure to help you as a homeopath. That may not always be possible, so you might have to allow that patient to go to the emergency room. I know a case which is worth talking about right now because we're talking about pathology. My own uncle was he was being treated for diabetes by a very prominent homeopath. The diabetes was almost 40 years old, and he was in his 60s. So in the late 20s, I think he got his diabetes. It was familial. It was not the type 1. He started homeopathy, and after about 6 or 7 months of treatment, he got one episode of hypoglycemia. He suddenly started shaking, shivering, felt faint, and he had been told, if ever this happens, you should take some sugar. So he took some sugar and started feeling good. About 3 weeks later, this happened again. So he went back to the homeopath, who said, my medicine is now working. Your diabetes is coming under control. So let's cut down your insulin. So he reduced the insulin a bit. Now, almost every 3 or 4 weeks, in spite of lowering the insulin gradually, my uncle used to keep getting these hypoglycemic attacks. And then one day he just collapsed. And fortunately, I used to live in the next building. So they called me. It was a day off. I rushed there, saw that he was hypoglycemic, he was sweating, and he was almost unconscious. So we made a strong solution of sugar, made him sit up and drink that. And I said, now it's high time that I also get involved in the treatment. And we got him investigated. And we found that the random blood sugar we collected, fortunately, his daughter is a lab technician. So she collected the blood and we sent it. So the random sugar was 50, very low. Next day morning, we got him investigated and we found that his blood urea and creatinine levels were extremely high. So what had happened was that this person did not respond to homeopathy. It was not homeopathy that caused the sugar levels to come down, but it was the fact that his disease had progressed. He went into chronic kidney disease or a renal failure. And it is the function of the kidney to filter out everything from the body. Now, when the kidneys are not able to filter it out, the insulin, it starts rising. It cannot be passed out. So the insulin gets collected in the blood, and you find that the level of insulin keeps rising. And he was taking insulin daily. So a point came when that insulin was too much for him and he used to go into hypoglycemia. In spite of the fact that the insulin was slowly reduced to almost, finally he was just taking 8 units, he was still getting hypoglycemic because even that was retained by the body. So what apparently was cure of homeopathy, of diabetes with homeopathy, was actually progression of the disease because the homeopath failed to investigate and to recognize the signs of further destruction within the body. So he developed a diabetic nephropathy. The kidneys were damaged, and the homeopath was boasting that his medicines had cured this patient of his diabetes. So you need to know your scope, you need to know your limitations. Let's look at this remedy that these are things that I got from Boric's Materia Medica. These are the head symptoms. As if the skull would burst, sensation as if the brain were balancing to and fro and striking against the skull, receiving great pain, intense throbbing of the head and carotids, spasmodic headache in the vertex with subsequent pain as if bruised sides of the head. The face is flushed. It is relieved from pressure and from warm room, and you find that the scalp is sensitive. It is worse from combing the hair, and headaches are worse in the open air from temple to temple, worse by contact and current of air and from stepping. So the first remedy that I'm sure came to most of you people's mind is belladonna. I'm sure you'll think that belladonna is a remedy because you have throbbing of the head, throbbing of the carotids, the face is flushed, patient is relieved from pressure, slightest jarring, like if he walks, he gets pain. Unfortunately, if that was the drug you thought of, you were all wrong. The remedy is cinchona. So cinchona is the remedy you should think of when the patient has symptoms which are so similar to belladonna. And I'm sure many of us must have given belladonna to a patient with similar headaches and didn't find a response. And we wondered why. What you need to do is look at the patient and see whether the patient is pale or whether the patient has congested face. Now, if you look at the Materia Medica of Boric, as you can see, all the symptoms that I have had in that previous slide are mentioned, but I specifically missed out one. Face is flushed after hemorrhages or sexual excesses or loss of vital fluids. That means this patient's headache is because of anemia, loss of fluids, especially after hemorrhages. Anemia can cause similar throbbing headaches. So when you look at the patient, study the pathology. What is causing the headache? Is it because this patient has an actual inflammation or whether there is anemia? So look at the pathology. The pathology is different, but the symptoms are so similar in these two remedies. Belladonna and cinchona both have throbbing carotids, both have a red flushed face, both have headache, bursting type, worse from jarring, worse from motion. But if you understand the pathogenesis of the remedy, understand what the remedy does to the prover, and you apply that to your patient, it makes it very easy. So in belladonna, there is inflammation. That inflammation causes vasodilatation. It causes the blood flow to increase. And that leads to congestion. And because there's excessive blood flow, you find throbbing, flushed face. In cinchona, you have hemorrhages and chronic hemorrhage leading to anemia. We know that for the bad effects of hemorrhages, cinchona is the remedy you should think of. And whenever there is anemia, there is a hyperdynamic circulation and there's a wide pulse pressure. That leads to the throbbing that you see in the carotids. That leads to tachycardia. That might lead to sometimes a false plethora. They get flushing, a redness of the face. And many of our anemic remedies, you have the pseudoplethora like ferrum metallicum, another remedy for anemia. And you have this false plethora. So pathology is different, but the Materia Medica symptoms are similar. And that's what is very important for us to understand. So when you're prescribing, don't just prescribe on symptoms. Symptoms are just a manifestation of the patient. But what is wrong with the patient is what you need to understand, whether it's inflammation in this case or whether it is anemia. Now, talking about anemia, let's look at one other remedy, which unfortunately is very rarely used by homeopaths for anemia, and that is aluminium. Now, all these symptoms that I have noted are from Boric's Materia Medica. So the common symptoms of alumina that we have is they are all delicate children. They're products of artificial baby food. They lack vital heat. There's a dryness of mucous membranes. There's an irritability and relaxation. There are pulsations felt in various parts. There's extreme exhaustion after talking, from menses. The menses can be too early, they can be short, they can be scanty, they can be pale, and they are followed by great weakness. So these are the common symptoms of anemia that we all know. That's what we've been taught in our Materia Medica. But what we don't realize is that anemia shows us symptoms also of iron deficiency as well as vitamin B12 deficiency. So it's a drug for dimorphic anemia. Now, you're not giving alumina instead of iron or instead of vitamin B12. but we are giving an alumina to this patient so that their metabolism changes, the absorption of these nutrients will improve, and they'll be able to assimilate and use these nutrients and make sure that we can, in that case, reverse the anemia. So what are the symptoms of iron deficiency? You have abnormal cravings, coarse food, chalk, charcoal, dry food, clean white rags, tea or coffee grounds, dry rice and indigestible things. These are all symptoms that are present in your Borix Materia Medica, and they are all indicative of iron deficiency. The throat feels dry, it feels constricted, the food cannot pass, there's a tightness from the pharynx down to the stomach, as if the food cannot pass. And then he feels the food the whole length of the esophagus. This is a syndrome known as the Plummer-Vinson syndrome or the Paterson-Kelly syndrome. If you study your books of medicine, you will find this very common in middle-aged women who have nutritional iron deficiency anemia, and they have difficulty in swallowing. If you do a barium swallow and examine and take an X-ray, you will find there are esophageal webs. So that slows down the process of the descent of the food. So you have features of iron deficiency. You also have features of vitamin B12 deficiency. Now this drug, alumina, it affects the cerebrospinal axis and it causes a degeneration of the spinal cord, especially the posterior columns. So our posterior columns are the ones that carry sensations of position, vibration. So if your posterior columns have been affected, which happens when there is a deficiency of vitamin B12, they don't carry the sensation of position, they don't carry the sensation of balance and vibration. So what happens? The brain has to now rely only on the eyes to notice where your body is and in which direction and which alignment your body is. Otherwise, it is automatic. Every nerve would be sending those sensations, impulses to the brain through the posterior column. So if the posterior columns are not working, then the eye compensates. The eye will compensate and tell the body, okay, right now your head is straight. Now it is tilted to one side. Now your hands have been lifted up, because the eye is able to see all that. But if you close the eyes, even that input now does not reach the brain, and the brain doesn't know whether you're standing, you're sitting, you're walking, and you start swaying as a result of that. And you find that one of the features of alumina is cannot walk with the eyes closed. So that is a very important indication of B12 deficiency or a posterior column degeneration in the spinal cord, and alumina is the remedy for that. So next time you study alumina, don't just think about the constipation of alumina. That is an important indication, but study alumina from a broader point of view. Ask yourself, why this symptom? If you ask why, it makes it easy for you to prescribe it in the future, because then you will have understood what it does to the human body. And if you know the pathogenesis of the remedy, it makes it very easy for you to make the right prescription. So if you look at different books, in Herring, you find there's a reference to anemia in women who are hungry for starch, chalk, etc. So even Herring's guiding symptoms in alumina, you find anemia has been mentioned. But we unfortunately seem to gloss over it when we study the drug. Tyler also talks about anemia with reference to alumina. Even in the condensed Materia Medica of Herring, you find he has talked about the obstinate spastic anemia. So that's something to do with the nerves. So they did know that there is something that can happen to a person with anemia with the nerves. Of course, in those days, physiology, knowledge of vitamins was not as advanced as it is now. So we find that now we are able to correlate and put 2 and 2 together. But that is something that was not so easy, but they were still able to figure out that alumina is a remedy for anemia. Alumina is also a remedy for spastic anemia. So there's something that goes wrong with the nerves because of the anemia that they have. Now, how to study the Materia Medica and how to use it in practice. So let's take the example of pulsatilla. The most important guiding symptoms on which you make your prescription for pulsatilla would be chilliness, evening aggravation, better by slow, gentle motion, worse in the warm room, and better in the open air. Now, how do we understand the drug pulsatilla and how do these symptoms appear? If you know what happens in this remedy and how the symptoms appear, you will know this remedy for life. You don't have to then try to memorize the symptoms. It's easy for you to make your prescriptions because you have understood the remedy and you see the same pattern unfolding in front of you in the patient, and you are able to now treat on the principle of like cures like. So the sphere of action, that's very important for us. Whenever you study a homeopathic Materia drug, you look at the sphere of action, then you study the pathogenesis. What does it do to that particular part or that particular aspect of the body? And when you understand the pathogenesis, you'll be able to derive the guiding symptom. So one very important feature or one very important part of the body that is affected is the blood in pulsatilla. And we all know that this remedy is a drug for anemia or chlorosis. In fact, such a severe form of anemia that sometimes the skin doesn't appear just pale, it might have a greenish tinge. That's why the word chlorosis. So whenever you have anemia, what happens is that the body tries to compensate. All the vital organs need blood. So there's a shunting of blood from the skin to the deeper organs. It goes to the liver, to the kidneys, to the intestines, to the heart. That's where the blood is redirected or shunted by the body, because that's a physiological response. You want to make sure that the vital organs get enough blood and the skin is not as vital. So what happens? The person starts feeling chilly because there's not much blood flow to the skin, and you start feeling chilly. You might start shivering. Now, the more the pains, the more the chilliness. That's what we've been taught in pulsatilla. How do we explain that? What does pain indicate? Pain indicates inflammation. So if there is inflammation somewhere, what are the features of inflammation? There's more blood flow to that particular part to cause some repair and healing. That's again a physiological response. So for example, the patient has, let's say, some inflammation in the intestinal tract. In this patient of pulsatilla, as it is, there's a shunting of blood to the vital organs, to the deeper organs. Now, she also develops some inflammation, either intestines or in the uterus or somewhere. This inflammation is going to cause more shunting of blood to that particular part. Where does that blood come from? At the expense of the skin. The skin is not as important right now for the body than the vital organs are, or the inflamed part is. So already blood was shunted from the skin to the deeper organs. Now, because of inflammation, further blood gets shunted off from the skin and she starts feeling even more chilly. So the more the pains, the more the chilliness is a classic guiding symptom of pulsatilla. Now, another action of pulsatilla is on the vascular system. And mainly it is the venous system. So the venous system will consist of the veins, the right side of the heart, and the capillaries. Now there's basically a weakness and relaxation of the veins. That is why you find pulsatilla is a good drug for varicose veins. This also causes a sluggish circulation. So as the day progresses, as the person is active and does things during the day, this right side of the heart and the venous system gets more and more relaxed, and the circulation gets even more sluggish. So by the end of the day, by evening, all the symptoms get worse because the patient gets even more tired. And you find evening aggravation is a very important guiding symptom of pulsatilla. So if you know the sphere of action, if you know the pathogenesis, you are able to understand a particular symptom. Now, because the veins are affected, the veins have become varicose, there's sluggish circulation. What happens? The flow of blood back to the heart, because the right side also is not working as well, is affected. But which is the second heart of the body? The second heart of the body is the calf muscles, the gastrocnemius. So when you walk, they constrict and they pump the blood back up. So as you walk, the second heart of the body, the gastrocnemius muscles, the calf muscles, they keep contracting and they help to push the blood up. Now this pulsatilla patient realizes that the circulation is sluggish, the venous flow is affected, but if she walks, she starts feeling better. And why does she feel better? Because the gastrocnemius or the calf muscles, they contract and they help with the circulation. But she knows that her heart and the circulatory system are quite weak. So if she exerts, if she does violent exertion, she's going to get worse. But if she does slow, gentle movements, she walks about slowly, gently, she starts feeling better. So by evening, as she gets worse, you might find she gets up and walks about. Gentle movement relieves her because that causes the calf muscles to contract and push the blood up. Now, exactly the opposite of this is sepia. Sepia is better by dancing. Sepia is better by vigorous exercise. Now in sepia, what happens is that there is a lot of pelvic congestion. So almost all the blood in the body seems to be in the pelvis, and that's why she has this feeling as if things are going to push out. She has this feeling of a prolapse or something is pushing out through the vagina. Now, in sepia, there is again an uneven circulation. And she realizes that the only way to improve this circulation and to make it go to other parts of the body is to exercise vigorously, because when she exercises, the blood flow to the muscles will increase and the blood gets redirected from the pelvic region where it's all congested to the other parts. And so she's always better by exercise, by violent exercise, better by dancing. While in case of pulsatilla, violent exertion aggravates, but slow, gentle movements will relieve. Now, continuing with the vascular system. What happens when you go to a warm room? You get a red hot iron and bring it close to your skin, and you just keep it for some time. You'll find that the skin, even though you haven't touched it, just the heat is enough to cause vasodilatation, and that area becomes red. So whenever you're in a warm room, there is cutaneous vasodilatation, and there's much more blood flow to the skin. Now we know that the pulsatilla patient is compensating its anemia by sending all the blood to the vital organs. So if it goes into a warm room, the blood now from the vital organs starts going back to the skin, and in general, she starts feeling uncomfortable. So you find that there's a reshunting of blood back from the vital organs where it is needed to the skin, and the patient is worse, therefore, in a warm room. But in the open air, if she goes out in the open air, you find that the cool air touches the skin and the blood flow is again shunted back to the vital organs and she starts feeling better. So you always find pulsatilla is better by slow, gentle motion in the open air. She would prefer to be in the open air. As soon as she comes into the room, in the warm room, she feels uncomfortable. Sometimes she feels suffocated. Sometimes she feels weak and tired. So if you understand the pathogenesis, if you understand the sphere of action, it makes it easy for you to understand the remedy. And that helps you in having this drug picture or the most important symptoms of the remedy imprinted in your mind forever. Now, this way in which to study Materia Medica and to use it in your practice is not only for big remedies like pulsatilla or mercury or maybe chamomilla or sulfur. You'll find that if you understand the sphere of action of even smaller remedies, and if you understand the pathogenesis, you'll find that the common symptoms are easy to understand and you realize why those symptoms are there. Let's take the example of the drug millefolium. It's also called Achillea millefolium. Now, millefolium is a remedy that in the case of pulsatilla, we have veins mainly. In case of millefolium, it is the capillaries. It is not the arteries, not the veins, but just the capillaries. So the sphere of action of millefolium is capillaries. The sphere of action of Homeopathic, for example, is again veins. But in case of Homeopathic, the pathogenesis is not varicosity and sluggish circulation, but in case of Homeopathic, the pathogenesis is inflammation. So it's a drug for inflammation of the veins, and that's why it's called the aconite of the veins. So wherever there is inflammation, that part becomes sore and bruised. And the symptom of Homeopathic is they have dark venous bleeding and they have a sore, bruised feeling from the part that is bleeding. So that bleeding part has that sore, bruised feeling because there's an inflammation that is there in that vein. But in case of millefolium, there's no inflammation. There is no sluggishness like you have in case of pulsatilla, but there is a fragility. The capillaries are fragile. They break easily. So the blood vessels have become very weak and fragile, and they break from the slightest injury, from the slightest movement, from the slightest pressure, which is the reason why you get, in case of millefolium, easy hemorrhages. They breathe easily from the slightest misstep, from the slightest touch. They might have easy bleeding from the nose. Someone touches the nose by mistake and it starts oozing out blood, because here the capillaries are extremely weak and fragile and they break easily and they cause hemorrhage. Sometimes they don't even realize that they're bleeding. Compare this with aconite, which has an inflammation, but that's more of arterial inflammation. And in aconite, you'll find that the bleeding is bright red and it gushes out. And looking at the blood, she becomes anxious. She becomes nervous. She gets fearful. She has a fear of death. Millefolium doesn't care because it's a very small amount of bleeding, and sometimes she may not even know that she's bled, because even the slightest injury, which is unremarkable, can cause the bleeding. So looking at the sphere of action and pathogenesis, you can derive the common symptoms, and it's always good to do a lot of remedy relationship, compare and contrast. While you're looking at your patient and noting the symptoms, your mind, one more window should open up, and that should be looking at which are the remedies that have this. Why is it happening? Are there any other remedies that have similar symptoms? How can I compare them? How can I differentiate them? So a lot of different windows are opening up. You need a lot of RAM inside to help you decide finally which is the remedy that you can give to your patient. I think we have another 30-40 minutes. So this is a case that we saw in our hospital when I used to teach at the Homeopathic College in India. This is again an example of why you must examine your patient. So examination is very important. Understanding pathology is important, but to make a good prescription, you should also examine. So this patient came to us with fever, dry cough, and pain in the chest, which was on the right side. It was a stitching sort of pain, which was worse from respiration. Slightest movements used to aggravate the pain, and the patient was holding onto the chest and breathing, better by rest and better by heart pressure. So the doctor who was handling this patient, all he did was he took the stethoscope and asked him, where is it hurting you? And he said, doctor, it's hurting me here in the chest. So he kept his chest piece there and he heard a pleural rub. He heard a rubbing sound. So he diagnosed this case as pleurisy. And based on some of those symptoms, he gave Briannia to this patient. And he called the patient 3 days later. So 3 days later, the patient's fever was still there. Sometimes it was not there. His cough was the same, but his chest pain had started improving. He was about 25% better. So the doctor asked him, do you remember, can you tell me where you had the pain? I've forgotten. So he says, doctor, it was here and it still hurts a bit. The doctor kept his stethoscope checked out there and he found that this patient's rub was still persisting. So he said 3 days of Briannia were not enough. Let us give Briannia for another 3 days. And the patient was called again to the outpatient clinic 3 days later. So almost a week after the first visit, the patient came back with no fever. His cough had reduced, but it was still there. There was no chest pain. And the doctor said, can you show me where you had the pain earlier? So I said, doctor, it was somewhere out here, but now I don't have pain. So the doctor again checked with his stethoscope and he did not hear a pleural rub. So he told the patient, you're cured. And he said, take these pills. He just gave placebo or saccharum lactis for 7 days and said, I'll see you after 7 days. Because we just want to make sure that things are okay. Come back after 7 days. We have been able to cure you of your pleurisy. But the patient came back just 4 days later. And he came back. I was a resident in the hospital. I was a registrar in the hospital at that time. He came back at night with severe breathlessness. He became cyanosed and we had to urgently admit him. So what went wrong? Here is a case that apparently was responding so well. The remedy that was given to him apparently helped remove the pain. His cough started getting better. And when the doctor examined him, his pleural rub had disappeared. So what went wrong? Why did this patient come back with symptoms that needed him to be admitted? And that too very serious symptoms like breathlessness, turned blue, and he was obviously in great distress. So what went wrong was that the patient was not correctly examined. And that's what's very important. I don't know how many of you are freshly graduated homeopaths, but this is a lesson that is worth learning. It's always good to examine your patient, to be a rational prescriber, to have a proper approach to prescription. Do not use the no-touch technique. You just look at the patient, smile, and say, don't worry, everything is going to be okay. I'm going to give you homeopathy, and you'll be fine. You need to also understand what's going on inside. And unless you examine, you will never know whether the patient has improved or the patient has remained the same or the patient has worsened. So let's go back to revisit all the 4 visits that he had with that doctor and see what should have been done. So if he had examined him properly in the first time, on inspection, he would have at least looked at the respiratory rate, which was 28 per minute, which is still high. He would have examined to see if there is any change in the trachea, whether the sternomastoid seems to be pushed down on one side, whether the movements of the chest wall are same on both sides. In this patient, the right chest, the movement would have been reduced. Then he would palpate and see if the trachea is central. He would also feel the chest and see if the movements of the chest wall have changed. He would also ask the patient to say 1, 1, 1, and then feel the what is known as tactile vocal fremitus. You ask the patient to say 1, and then you feel with the side of your hand the vibrations. And depending on how the vibrations are, you would know whether the patient has possibly a solidified lung or there's fluid in the lung or it's just normal air. If he had percussed with his hand, he would have found that there was possibly some dullness in the right lower zone. And then after that, he should have auscultated. He should have listened with the stethoscope. So he missed out the first 3 steps of examination and went straight to listening for what he wanted to listen for. because he had already made this diagnosis of bryonia. He had already thought this patient could be having pleurisy or an inflammation of the pleura. So he was only interested in listening for a rub. And he heard that, but he missed out inspection, palpation, percussion. He also missed out listening to other parts of the lung. And he would have found that the breath sounds anyway were reduced in the right lower zone. The sounds were more bronchial and not bronchovesicular. And there is crepitations. There were also crackling sounds heard in the chest. So the diagnosis would have been pneumonia with pleural involvement, not just simple pleurisy, but it was actually an underlying pneumonia with an extension involving the pleura, and now he had chest pain. Remember, pneumonia does not cause pain in the chest because the lung does not have any pain-sensitive nerve endings. It is the pleura which has got pain-sensitive nerve endings. So whenever the pleura is inflamed, you get pain. So this is something that was missed out. In the third visit, when the patient came back, he actually had developed a pleural effusion, a right pleural effusion. If he had inspected, he would have found that the respiratory rate had gone up. Right now, the trachea had not yet shifted because it was maybe just the beginning of the effusion. But his apex beat had shifted outside the mid-clavicular line. So the apex, that means the heart was being pushed away by something. That means there was fluid collection on the right side, which was pushing everything to the opposite side. That was missed because he didn't inspect the patient. If he had again listened and felt with the hand, he would have found that the chest movements were reduced. He could have checked and seen if the trachea is in the center or it has moved. So it was just the beginning of pleural effusion when the patient came in the third visit. And because there is effusion, the two layers of pleura are now separate. So when the patient breathes, they don't touch each other because there's fluid between the two. And so the pain has gone. Earlier, because they were inflamed and they were touching, that was causing pain. So you have a person who developed a pneumonia that went into a pleural involvement, and now that pleural pathology worsened to effusion, and there was collection of fluid in the pleura. So what the homeopath felt, he could not hear the rub because there's now no longer any friction, and for him, because the patient had no pain, little bit of cough, it was as good as cured. Wait and watch. But when he came for the visit in the hospital as an emergency case, when I examined him, his respiratory rate was 44. He had severe cyanosis. His trachea had shifted to the left. You could see that the sternomastoid was pushed out. You could see the bulge out here because the trachea had shifted, because the whole of the lung had been pushed. It had collapsed because of the fluid collection and it had pushed to the opposite side. On examination, the right side was not moving at all. When we opened the garment and we looked at the chest, we could see the apex beat was pretty shifted outside the mid-clavicular line. And even the intercostal spaces on the right side seemed full. So between the ribs, the space between the ribs seemed as if it was bulging out. On palpation, we confirmed that the chest movement on the right side was affected. Trail's sign was positive. The apex symbol had moved out. So trail sign is when you try to feel here, you can always feel the trachea in the center. But if your finger, the side of the finger touches the trachea, that means it is shifted to one or the other side. So that had become positive. That means now even this upper part of the mediastinum had moved away. And the tactile vocal fremitus had reduced. So initially, if it's pneumonia, it increases, but when there is fluid, it decreases. So all this pointed towards a massive pleural effusion. I had to put in a needle and aspirate, pull out some of the fluid so that the patient could breathe better. And we called the doctor, and then finally he decided that he had to revisit the case, and he gave calicarbonicum. Now, calicarb and bryonia have very similar symptoms in the respiratory tract. Both have got chest pains, both have got cough, both are, can get right-sided pains, both have pleural involvement. So what is important is if you understand the patient's problem by looking at the sphere of action, the pathogenesis, or in the patient, the pathology, you examine the patient, that makes it easy for you to decide which is the right remedy. So if you take the pains to give your best to your patient, if you are more rational in your approach, you are going to get a much better response. The patient is going to be much better in a shorter period of time with a lesser amount of medicines or the doses of the medicines to be given, because you have made the correct prescription. So basically this is what it was. He had stony dullness, his breath sounds were absent on the last visit, and we diagnosed this as a right-sided pleural effusion. Here's another case that I want to share. This is a case from 1989, when I was a very, very junior homeopath, just a few years into practice. And this patient now, after 25 years, has started coming back to me again for some other symptoms. So he attends my office in Mumbai, and I have Skype calls where my assistant doctors examine the patients, they take the history, and then me and my wife, depending on whose patient is, we make the prescriptions. So when this guy was young, he was 17 years old. He was appearing for his 12th grade exam, which is very important because that was going to decide whether he becomes an engineer or a doctor. And he was a known case of asthma. His father called and said, I'm at work, but my son has suddenly got severe chest pain and he's breathless. Can you see him? And I said, sure. And he came to my office. While he came to our clinic, while we were taking his history and as I was examining, he almost collapsed on the couch, on the examination couch. He was really breathless. But when I felt his neck region, I could feel crepitations, crackling under the skin. And that made me think of the possibility that one of the bullae in the lungs had ruptured, and air had leaked out from the lungs into the mediastinum and had also entered in the subcutaneous region. Now, this X-ray, of course, is a positive of the actual X-ray, but you can, where the arrow is, you can actually, if you look carefully, you can see it's not completely white. That's black and white. That's where the air has been trapped between the soft tissue. It has come out of the lungs and entered the soft tissue, and everywhere on the upper part of the body, if you feel, it was like a crackling. You could feel that there's something underneath it. So we sent this patient right away to the hospital because I could admit the patient there and see how we can help him. We also called up the ENT surgeon who was attached to a hospital and said that we have this case who has come with most likely a ruptured emphysematous bulla, who might need a tracheostomy because he was really choking. So we thought maybe as an emergency measure, they might have to open up the trachea and allow him to breathe better. So we told him that we are going to keep him nil per oral, nothing to be given, and we'll monitor him with homeopathy, but he might need to come in anytime and help us with a tracheostomy. So this patient's X-ray, this is the first X-ray that was done in the evening. We had sent him to one of the radiologists who had an office near my clinic. And 3 days later, after we gave the homeopathic remedy, in this case, Briannia was given to him. His symptoms had almost gone. He was able to move his neck. Otherwise, even the slightest movement of even a bit of the neck or the upper part of the body used to cause severe pain and breathlessness. He had very shallow, hurried respiration. So 3 days later, you see the X-ray, most of the air has been absorbed. And 7 days later, on the 24th of Feb, 1989, it was completely clear. Almost everything had gone. This was the fastest recovery that could have happened with homeopathy in an acute disease. And for that, you need to examine. If we had not examined the neck region, I would have missed the fact that there was a rupture. And maybe he would have collapsed and his state would have worsened. And it would have given the other doctors a chance to once again blame homeopaths for being negligent. So what I'm trying to get at is, to make a rational prescription, you also need to examine. You also need to make judicious use of investigative methods. Like in this case, of course, the X-ray helped us a lot, and it also helped us monitor the patient's recovery phase. This patient finally went to a pulmonologist because his father was working in the airlines, and he was a general manager with the national airline, and he felt that this young homeopath who doesn't even have enough hair on his face claims that he's cured my son. I might want to just show it to somebody who's more experienced. So he took all the x-rays and he took his son to a pulmonologist who was shocked that the response was just 7 days, because he said with conventional treatment, we would have given antibiotics, we would have maybe done a tracheostomy, we would have kept him on IV fluids for a long time. And it would have taken at least 2 weeks, 2 to 3 weeks for him to have recovered completely and for all the absorption of the air that had leaked out into the mediastinal space. So homeopathy can work fast. Homeopathy can really do a lot of wonders, but you need to be more rational in your approach. That doesn't mean I'm trying to only point out that we need to give constitutional remedies, and you should not be giving constitutional, you should only prescribe on pathology. But there are always conditions or patients where pathology becomes important, and you might have to prescribe only on pathology. We have about 5 minutes, so I can quickly go through 2 short cases. Again, these were cases that we had admitted in the hospital. This was a farmer who came with dyspnea, progressive breathlessness. They had diagnosed him as a case of congestive cardiac failure, or in the West, in the US, we call it CHF, congestive heart failure. His breathlessness was worse on lying down in a warm room. He was better in the open air. It makes you think of pulsatilla, but pulsatilla cannot go so deep and bring about such a lot of recovery. Plus, in this case, we had some other symptoms or other features that helped us make the correct prescription. He felt the heart was beating all over the chest. So in those days, we had an integrated clinic. As a homeopath and as a Materia Medica person, I used to sit with somebody from the Department of Internal Medicine. So there would be a conventional MD doctor and me sitting and working on cases together. He had referred this patient to me in the ward, and he said, let's give homeopathy. Let's watch what happens. And we said, sure. The other symptoms that this patient had was the bladder feels full. There's a frequent urge to urinate. The urine is scanty and offensive. There were no general symptoms. There were only 2 mental symptoms elicited. One was dullness of the mind. He cannot think properly. And this also was given by his son. And irritability, especially when asked any questions. Unfortunately, homeopaths have this very bad habit of asking questions to the patients. And this patient was pretty upset by the fact that people are asking him questions. Now, dullness of the mind and irritability can both be features of congestive cardiac failure, and you can't really think of using them as the prescriptive totality, or to use them as the peculiar, queer, rare, strange symptom. So these are all symptoms of gross cardiac failure. He also had edema of the feet, the face was puffy. We looked at the ECG and it showed inverted tick mark. So the T wave, it showed like an inverted tick mark. This means this patient was already in digitalis toxicity. Now this consultant wanted us to start homeopathy so he could taper off the digitalis and keep the patient try to get the toxicity out. The 2D echo had showed dilated cardiomyopathy. That means the muscles of the heart were so weak that they were not able to pump, and the whole heart had become dilated. This usually indicates a very poor prognosis. Patients usually do not last for more than 6 months to a year after they have been diagnosed with congestive cardiomyopathy. So because of this, the fact that this patient had advanced pathology, we decided to give a drug which had mainly heart as the pathology. And our first aim was to help him drain out all the excessive fluid that is collected everywhere, and also work on reducing the digitalis that has caused the toxic symptoms. And the drug that we gave was Convallaria majalis. Now, if you look at Borix Materia Medica, it actually has the symptoms which are mentioned in the patient's scan. It shows that the ventricles are over distended and dilatation begins, and there is an absence of compensatory hypertrophy, and when stasis is marked. So it's classic congestive cardiomyopathy. We gave 15 drops of the mother tincture to this patient every 3 hours, and simultaneously the physician started reducing the dose of digitalis. And we found within 12 hours, the urinary output increased. And by the third day, we had drained him of his excess fluids, his edema had disappeared, and he was no longer dyspneic. Of course, we are not looking at cure in this case. What we wanted to do was palliate him, make him feel more comfortable, and also to help take care of the toxic side effects of the digitalis that he had. This patient finally, I think about 6 months later, he did die. But our aim was to give him a better quality of life. And he went back and was using Convallaria once a day, mother tincture, 15 drops, till finally he went into some other complications. He had a pneumonia, and then he had multi-system failure, and he died. The second case, again, was admitted in our hospital. He was a 70-year-old man, and for 40 years he had chronic bronchitis. And he came with a severe exacerbation of the chronic bronchitis. So when I saw him in the wards, there was a lot of rattling of mucus in the chest. Unfortunately, one drug that has been hammered into our head for rattling of mucus in the chest, or the death rattle, is antimonium tartaricum. And antimonium tartaricum may not always be the remedy for you unless the patient has a death rattle. So if he's really gasping for breath, he's in respiratory failure, that's when you should think of antim-tart, and not for every case which has a cough which is loose and causes rattling sounds. I would rather give that patient either Calisulf or Amoncarb or Heparsulf, which have loose rattling cough, and the cough expectoration is sometimes easy to bring up. So you can actually compare those remedies later on when you have the time on your own. For want of time, and to make sure that we stick to the topic for today, I'm just going to continue with this case. So he could not bring out the expectoration. He was already on antibiotics. He was on bronchodilators, expectorants. There was a respiratory physiotherapist who used to come and help him with his chest, but it didn't really help. Even nebulization got no relief. So this patient was again referred to me by the consultant who was attached to a hospital. His blood pressure was 174 systolic, and the diastolic was just 82. So he had a wide pulse pressure. This is called systolic hypertension. He had a lot of wheezing and bronchi, a lot of crepitations, a lot of crackling in the lungs. That means there was fluid as well as bronchospasms. His X-ray showed a lot of bronchovascular markings. It's prominent bronchovascular tree. You could almost see the whole bronchovascular tree in the lungs. His ECG, which we got done in the hospital, showed a P pulmonale. That means the P was tall and peaked. This indicates a right atrial enlargement. The drug that we gave him was Beritamur 30, given 3 times a day. Now, this is a drug for systolic hypertension. This is a drug for bronchial affections of old people with cardiac dilatation. This is how it's given in Borix Materia Medica. It facilitates expectoration. There's great accumulation and rattling of mucus with difficult expectoration. Arteriosclerosis of the lungs. Thus, in senile asthma, it modifies the arterial tension. So you're looking at a remedy that was actually fitting this patient's pathology. It was fitting his symptoms. And we were giving this, we gave it to him not to maybe cure him, but to relieve him and to palliate him. Chronic bronchitis usually ends up in a condition called cor pulmonale, where there's a dilatation or failure of the right side of the heart. And this remedy stepped in at the right time to help prevent him from going into a stage. He was already going towards congestive heart failure with the rattling and the crepitations. We were able to bring him out and reverse the symptoms and the pathology and give him a better quality of life. So the basis of prescription, to make a rational prescription, the best approach is, of course, the constitutional drug. But sometimes you have to resort to other ways to prescribe. Just like how you individualize a case and you prescribe an individual remedy, a single remedy for that particular set of symptoms. Similarly, every individual who comes to you needs a different approach, and your prescription would depend on what his problems are like. So it could be a keynote or a characteristic symptom on which you might sometimes prescribe, or you might repertorize the whole case and then make a prescription. Sometimes you have to prescribe only on the cause. Sometimes you prescribe on the basis of the miasmatic influence. In some conditions, you have to give specifics. Sometimes, like what is going on currently, people talk about the genus epidemicus and the prophylaxis. You might need to use the bowel nosodes or the nosodes in your practice. Or you need organopathic remedies. That means they have action mainly on a particular organ. It could be an inflammatory action. It could be action where there is a new growth that forms there. And if you have a drug which can do that, it should be able to help reverse it in your patient. Or in very rare cases, you do tautopathy. Whatever causes the symptom, the same substance can be potentized and used to treat. So patient who has had, for example, a reaction to streptomycin or penicillin, you could actually potentize the remedy and give it to him, and that is tautopathy. So my aim today was not to mainly to encourage you to make classic constitutional prescriptions, but at the same time, be open to the fact that you need to be more rational and scientific in your approach, and be open to the fact that there are different ways of looking at different patients, and each patient will determine how you are going to prescribe and what is the best way in which you can give that patient relief in the symptoms. Thank you very much for being patiently listening to what I had to say. Of course, I have condensed it. I've removed a lot of other material to underscore the point that it's very important for you to look at the sphere of action, the pathogenesis, and make your prescription. But I think this was in a nutshell something that I feel very strongly about, and I thought I should